And those who tell us that we can't, we will respond with that timeless creed that sums up the spirit of a people. Yes, we can.
The slogan, Yes We Can, has been used by President Obama in trying to rally up support of passing the health care reform. A trend that has been found in many students that were surveyed is that most of them believe that the health care reform will provide more money for Americans and make it more affordable and available for everyone. But they weren't aware of the full details that come with it.
Do you have health care insurance?
Yeah, I do. Yeah.
Yep.
Yes.
Can you tell us what you know about the health care reform?
I know that it was passed by President Obama. I just know that so far it's not working. But he has a plan and he has hope. So lets us have control and let us have the final say rather than the insurance.
Honestly, I didn't know that much about it. All I know is it's helping people not get denied health care depending on it, and gives us more freedom.
Do you think this reform will benefit the citizens?
I think it will, just because of the fact that the economy is going down so badly.
Obviously, it's going to benefit citizens because it's not denying different people health care that actually need it and don't make that much money.
Do you think it's a good or bad idea?
Yeah, actually, it's a good idea. It will help out the people, and especially the people that don't have benefits at their jobs or things that they want to provide for their families. It will help them out.
I surveyed people from middle age to retired age and found that they were more informed than the younger generation about the healthcare reform facts and what it means to our economy.
About the healthcare system, I think it's a great idea. I think the main purpose behind it is that it was hurting people before, but now that they have the insurance going out, I feel it's going to benefit so many other people. For example, people who didn't have insurance before, all it was sucking the money out of the United States, because if someone was sick, went to the hospital, they pretty much got care for free, and the state or the country had to pay for that. Now that people have insurance, it's going to lower the rate of the money that's going out to patients, so it's going to help our economy.
This legislation will also lower costs for families and for businesses and for the federal government, reducing our deficit by over $1 trillion in the next 2 decades. It is paid for, it is fiscally responsible, and it will help lift a decades-long drag on our economy. That's part of what all of you together worked on and made happen.
On the new reform that's going into place with healthcare, what I do know in the current healthcare industry is that the insurance carriers and Medicare have recently reduced their rates 30% to the private sector or physicians' practices, making it almost impossible for physicians to pay their overhead and stay in business, causing a lot of patients having to go to the hospital. I know with some of the cuts going deeper into Medicare, I know ancillary services like physical therapy and probably some other minor therapies will be cut and won't be covered anymore by Medicare. We're just going to have to wait and see how that pans out.
My impression is the healthcare debate ended up being a political debate instead of a policy debate. What really needs to be accomplished long term is a reduction in cost, since our country can't afford $2.6 trillion per year, which is presently spent. And unfortunately, the reform bill became a political hot potato between a Democratic versus a Republican point of view, when it should have been a bill that provided better health care, better access, and reduced long-term cost to the country.
We did not fear our future. We shaped it.
If it is a good change or a bad change, it is a needed change.
In order to get a realistic idea of how many people were for or against the health care reform, we surveyed over 200 people of all age ranges, political parties, and socio-economic backgrounds, and found the following results.
This is the graph of Republicans with healthcare. The numbers along the left represent the numbers of people surveyed. The numbers along the bottom represent their age ranges. The red bar indicates how many people surveyed in this group were against healthcare reform. The blue bar indicates how many people surveyed in this group were for healthcare reform. Republicans overall were more against the healthcare reform, but those that already had health insurance were more opposed to health reform, especially the older Republicans. It seems that the older the Republicans were, the more they were against healthcare reform. This is a graph of Republicans without health care insurance. Here it is seen that less than 20 out of 200 people surveyed were Republicans without health care insurance. It is interesting that the Republicans without health care insurance are more for the reform than initially expected. Still, the trend is that the older Republicans tend to be more against the reform. This is a graph of Democrats with health care insurance. This group of people tend to be much more for the health care reform, especially those in the younger age ranges. This is a graph of Democrats without health care insurance. This group of people have the highest approval rate for the health care reform.
It was apparent after all of our surveys and interviews that few people actually knew what was in the health care reform bill. Here are the important things that will begin this year. Tax credits will be given to 4 million small businesses that offer health insurance to their employees. Tens of thousands of people with pre-existing conditions will be able to purchase insurance. Insurance companies will not be able to drop coverage when people get sick. There will no longer be any limits on coverage that an individual can receive. New plans have to provide preventative care. Age cutoff for students on their parents' insurance will now be 26. Seniors that fall into the donut hole will receive $250 a month to help for the cost of prescriptions.
Today, after all the votes have been tallied, health insurance reform becomes law in the United States of America.
How do you feel about the health care bill passing?
You know, I've supported the health bill for a long, long time, and that was one of the reasons why we supported President Obama, because we thought for sure he would really work hard at it. And when at first, you know, a lot of people had their doubts that it was going to happen because of the Tea Party, but I never lost hope. I just knew that something wonderful was going to happen. I am so happy that it's passed because it's going to help so many people, especially the poor.
The classic poet Virgil once said that the greatest wealth is health. The greatest wealth is health. Well, today, America becomes a whole lot wealthier because tens of millions of Americans will be a whole lot healthier from this moment on.
Once the bill goes into effect, do you believe it will stabilize and help our economy?
You know, there are a lot of unanswered questions, but I think that it will stabilize the economy because it's going to help people be more interested in the medical profession. Right now, I think the way that things are, or they were, people were afraid to go into the medical profession because they were afraid of losing their jobs, and even small businesses will benefit by it.
It will reduce our deficit by more than $100 billion over the next decade and more than $1 trillion in the decade after that.
Do you feel that there are any cons to the bill passing, or do you feel that it's mostly just positive?
You know what? There's a lot of people that fear change, and until there's a lot of questions that are unanswered, and you know, that's life. You have to try something before you find out whether or not it's going to work. And I'm a firm believer of the quote that Bobby Kennedy used to say: some people see things as they are and ask why, but I see things that never were and ask why not. Some people fear things just to fear, and others are against a lot of things just because that's what their party believes in. I really believe that everyone should have medical insurance. Being healthy is a right. It's not a privilege.
We are done. It was a creed written into the founding documents that declared the destiny of a nation. Yes, we can. It was whispered by slaves and abolitionists as they blazed the trail toward freedom. Yes, we can. Yes, we can. It was sung by immigrants as they struck out to distant shores, pioneers who pushed westward against unforgiving wilderness. Yes, we can. Yes, we can. It was the call